Hello there, it's Dr. Charles Modlin, your friendly urologist. I'm here with you for another health equity brief. Remember that these health equity briefs are opportunities for me, Dr. Charles Modlin, urologist, health equity advocate, to speak with you, the listening audience, about important health information that I think is necessary for you individually, as well as your family and community to know to improve and maintain your health. So today's topic in this health equity brief, I'm going to talk about disparities in the incidence, treatment, and outcomes of neurologic disease in African American populations. So neurologic disorders encompass a broad range of conditions affecting the brain, of course, the spinal cord, as well as the peripheral nerves. These disorders can have significant implications for an individual's overall health, quality of life, and mortality, as well as their mental health. Disparities in incidence, outcomes, and treatment options for neurologic disorders between Black and white populations are well documented, highlighting the need for targeted interventions to address these inequities. That includes interventions to raise awareness, raise the health literacy in Black and brown communities, to become aware of what these neurologic conditions are and the treatments and screenings that are recommended so that we can help eliminate these inequities. So let's talk about incidence and mortality rates. First, let's say a few words about stroke. So African Americans experience a higher incidence of stroke compared to whites. The age-adjusted stroke incidence for African Americans is approximately 1.5 to 2 times higher than that in their white counterparts. Mortality rate from stroke in blacks is much higher, with Black men having a stroke mortality rate that is 50% higher than that of white men. Alzheimer's disease is another neurological disorder, Alzheimer's disease and dementia. Again, the incidence is higher in African Americans, with African Americans being about twice as likely to develop Alzheimer's disease compared to white Americans. Studies suggest that nearly 13% of African Americans aged 65 and older have dementia, compared to only about 8% of whites. That's data from the Alzheimer's Association. Mortality rates, African Americans also face higher mortality rates from Alzheimer's disease, with studies indicating that they are more likely to die from the disease compared to their white counterparts. My father actually suffered from Alzheimer's disease, so that is a condition that has touched me and my family. I actually served as a primary caregiver for my father also. So the incidence of multiple sclerosis is another neurologic disparity that we see. African Americans are diagnosed with multiple sclerosis at lower rates than whites, but the disease tends to be more severe in African Americans afflicted with multiple sclerosis. So mortality rates for multiple sclerosis is higher among African Americans, likely due to delayed diagnosis and inadequate treatment. Reference is Whalen et al. 2019. That's Wallin. Another disease, neurologic disorder, is Parkinson's disease. African Americans are diagnosed with Parkinson's disease at a lower rate than whites, yet again, the disease may present with more symptoms, severe symptoms in African Americans, and a poorer prognosis. Mortality rates, African Americans experience a higher mortality rate from Parkinson's due to factors such as delayed diagnosis and disparities in treatment. So what are some of the risk factors for these disparities in these neurologic diseases that I've spoken of? Socioeconomic factors. We've talked about the role of socioeconomics and social determinants of health with respect to a number of health disparities that we see in Black and brown populations. Lower socioeconomic status among Blacks can lead to reduced access to health care. This contributes to disparities in diagnosis, delayed diagnosis, treatment, availability, access to treatment, and management of neurologic disorders. Economic barriers, lack of insurance, limited access to specialty care can hinder timely intervention. So Cultural and linguistic barriers, mistrust in the healthcare system. We talked about that, rooted in historical injustices, such as the Tuskegee syphilis experiment can lead to delayed treatment and poorer health outcomes. Language barriers, of course. Other comorbidities in blacks can predispose individuals to a higher incidence of developing these neurological disorders, but also a higher complication rate and poorer outcome. Higher rates of hypertension, diabetes, obesity can increase the risk of developing neurological disorders such as stroke and dementia. CDC, data comes from the CDC, Centers for Disease Control. Access to care, again, is another socioeconomic, geographic barriers, lack of transportation, lack of health insurance. So there's also in the literature evidence of differential treatment options and medications. Let's talk about stroke. Again, African Americans are less likely to receive timely and appropriate interventions for stroke, such as thrombolytic therapy and endovascular procedures compared to white individuals. Data from Hernandez et al. In 2019. Factors contributing to this disparity include biases in treatment decisions and differences in healthcare access. Alzheimer's disease, treatment options for Alzheimer's disease, including cholinesterase inhibitors, may be underutilized among African American patients due to differences in access to care and provider biases. That's from the Alzheimer's Association Research and Data 2020. Cultural perceptions of dementia may also affect the willingness of individuals to seek and adhere to treatment. Multiple sclerosis, African Americans with MS may face disparities in access due to disease-modifying therapies, leading to worse health outcomes in blacks compared to whites. That's data from 2019. Delays in diagnosis may contribute to more severe disease progression in blacks. And again, Parkinson's disease, African Americans may receive fewer referrals for specialized care and access to advanced therapies, including deep brain stimulation, compared to their white counterparts. There are disparities in patient education resulting in regarding treatment options and disease management as well. So what are some of the solutions? Again, we've spoken about this in previous health equity briefs. We need to promote policies that will increase access to care. All healthcare providers should undergo cultural competency training to better understand and address the unique needs of African American patients. Community engagement, engaging, and the onus is on the healthcare providers to engage with African American communities to raise awareness about neurologic disorders and available treatments. Signs, symptoms can improve health-seeking behavior. I mentioned policy advocacy, and of course we do need more African Americans, people of color, to participate in research studies that will help identify new treatments and therapies that will be more efficacious and efficient in black populations. We talked about in previous health equity briefs that there is a lack of, in many respects, African Americans participating in clinical research trials due to distrust issues and other circumstances. So in conclusion, disparities in the incidence, outcomes, and treatment options for neurologic disorders among African Americans compared to white populations are significant and multifaceted. Addressing these disparities requires a comprehensive approach that includes increasing access to care, improving cultural competency, and engaging with communities to promote awareness and education. By working to eliminate these disparities, we can improve health outcomes for African Americans affected by neurologic disorders. So please like, share, subscribe, pass this information along to others. Until next time, this is Dr. Charles Modlin. I'll see you next time on another Health Equity Brief. Thank you very much for being with me, and please continue to stay alert and aware of future programming. Thank you.